Hi, everybody. My name is Nathan Aswell. Welcome to Small Steps, Big Life. I'm in Vancouver, BC, Canada, and joining me today is Annette. Annette, I've never asked you how to pronounce your last name. Can you say it for me?
Sure, it's Ridenour.
Ridenour. See, I said Ridenour. Ridenour. Annette Ridenour, originally from New York, and has been a San Diego native since 1973. And while we were waiting to get started today, she was telling me more about her San Diego life. San Diego is one of the most beautiful places on earth, and I have had the good fortune of meeting Annette several times through the San Diego Conscious Music Festival. The first one was in November of 2013. The second one just happened in November of this year. And while I was there, I was speaking to Annette about some very interesting and powerful work that she's doing in the world. And that's why she's here. Welcome, Annette.
Well, thank you.
Thank you. And I would like to welcome the folks who are with us so far. We have Lisa, we have Anne, and we have Suzanne. And hopefully we will have Karl Anthony joining us. Karl is someone who is also based in San Diego and is someone who has connected up with Annette and has his own take on the work that is going on in hospitals. He's actually playing a very pivotal role in what Annette does. And he's just having trouble getting online. So we're hoping that he can join us as soon as possible. So, Annette, let's go back and tell me, I'm eager to talk about the work that you do in hospitals, but just take us back to how that began. What was the inspiration for all that? How did it begin?
Sure. So after I moved to San Diego, I was an artist, trained as an artist, worked as an artist ceramicist in New York City. I realized that there were no large fine craft galleries in San Diego. So I had the opportunity and in 1975 actually opened a very large craft gallery, 10,000 square feet, representing about 100 artists in all different media. And in about 1977, an architect walked into the gallery and slapped a roll of blueprints on the counter and said, "I'm building a hospital. Can you do an arts program?" And I said, "Okay, what's an arts program?" And so he said, "Well, we need art in this hospital. You seem to know a lot of artists. Show me what you can do." Wow. So I was fascinated with the whole idea. I had no concept of the idea of art and healing at that particular point. Mm-hmm. I did a literature search. There really was almost nothing. There's the world of art therapies, music therapy, but really nothing related to visual arts and healing or arts in the environment and healing. So I called up a bunch of artists that I knew very well, and we had several meetings and wound up commissioning original artwork for this whole hospital. And it became very life-altering for me, the whole idea of the power of the arts, to transform lives and to make a difference in healing. So in 1980, I founded my current company, Aesthetics, for the purpose of bringing art to hospitals. And so at that particular point, there were some individual hospitals in North America that were working in isolation, really inventing the field. So I guess it was sort of like the early 80s. There was sort of an original symposium of people who, there's like 17 of us from Duke and I think Stanford, and we had Michigan. So it was a variety of different hospitals that were experimenting with arts programs, and we got together and created an organization then called the Society for Arts Administrators, which over the years turned into the Society for Arts and Healthcare, which turned into the International Alliance for Arts and Health. So I guess I was very pivotal in the developing of the field without a plan. I didn't start life off to do this. But as many artists, I think their personal life connections and their paths and their professions sort of interconnect. And I had the great opportunity of doing that. As I, went on my personal spiritual journey, I found the work deepening and the opportunities deepening. So projects came, and I guess it was in the late 80s when I realized that visual art wasn't enough. That I had always used music as part of my spiritual path, and I knew the healing power of music, and so it's probably in the late 80s. I was at a medicine wheel and met Don Campbell. Mm-hmm. And if the audience doesn't know who Don Campbell is, he's a very, very famous musicologist who wrote the Mozart Effect and the Mozart Effect for Children, and his work and recordings, were been translated into 12 languages and has sold multi-millions of copies, and really has been, he was an innovator in the relationship between music as a tool for education. Mm-hmm. So I inspired Don to think about creating original music for healthcare. Yeah. And he had studied with Tomatis, and which is another form of listening for learning and healing, and was very excited about it. And so he went into the studio for 3 years to really look at the world's music and to help create programs for healing. And so that was a very exciting time in which, besides doing, trying to create a physical environment, working with visual artists to create, a certain harmonic of the physical environment to what the patient needs. And, so we really felt that, different types of patients needed different sounds and rhythms. And so Don created specific programs for, for an emergency department and for chapels and for birthing and for navigating in the hospital and for ICU and for employees areas. And so we incorporated that work in the aesthetics work with under aesthetic audio systems. Mm-hmm. So music, the whole idea of working with music and creating an auditory environment that supports healing along with the visual arts is something that, I've been trying to foster for many, many years. And so in 1989, I had the opportunity of doing an arts program for San Diego Children's Hospital, and it had a huge success. It was won lots of awards, but it really resonated with the staff, the physicians, the community. This is really different. This is an environment that creates all these positive distractions, puts a smile on people's face, is educational, and just changes the energy. And so I had a very, very good relationship with the CEO, and so it really was my my playground, to be able to try new things. And so after we did the visual art, I brought up the opportunity of doing participatory art, bringing in live musicians, to work with the patients, and artists as well to work in the waiting rooms, as well as to go from patient room to patient room, based on, really what does the patient need? And it was sort of an uphill challenge. I kept suggesting it, and then all of a sudden there was a California Arts Council grant that needed to be a matching grant. And so I decided, well, this will never start unless I fund it myself. So I put up, I think, $10,000 and got $10,000 from California Arts Council, and that launched the program. And and it's been going on, I think, for almost probably 20 years.
Wow.
You know?
So I just wanted to interrupt you for a second, if I may. So Don Campbell was the fellow that you mentioned initially?
Yes. Mm-hmm.
So I'm just wondering what happened to Don's involvement. Did he continue with you when you went into this phase, or did he kind of fall away and then you got local people involved? Like, what was that transition, or was it a transition?
Well, no, it's not an either or, it's an and.
Okay.
It's an and. Nothing replaces live music, live performances.
Right.
That's the optimal experience, is when, when a musician such as Karl, so let's bring Karl in, this will help explain this, because Karl, I think, was hired 10 years ago by the arts administrator at Rady Children's to play with children. And he has done the most magnificent job of developing music ministry for children. He has learned how to enter a patient room and really make the child the center of the universe and bring out from the child what they need at that particular point. And a guitar and music is his toolbox. And he's, magnificent at it. And so there's, nothing, when you talk about hospitals, you could have really a terrible environment, but if you have the most caring, loving people and professional medical physicians, the environment sort of does fade away. I just did I did a focus group for a hospital, and had all kinds of problems with the environment. But the patients kept saying, "Oh my God, the staff, they're so, loving, they're so caring," and so that's the number one component. So when we have music and healing, the optimal situation is to have really good, qualified, trained musicians and artists working with patients. That's the optimal. But we don't have that 24/7,
Right. And so what does it mean to you to have trained musicians?
Well, in order to, have an artist go into a hospital, they need to go through a training, and the training is to really understand a little bit about the different diseases, a little bit about the treatments that these patients are going through, and their role. And it's a very intimate relationship when an artist can interact with a patient, and the privacy that needs to be respected, the information that may come up. A patient may decide to tell things to that artist because they've created a bond, and that information then needs to be communicated to the nurse. How to handle going into an intimate relationship, how to handle looking at a child that is bald, or an 85-year-old man who will be dying very soon, or a person who's in a lot of pain. How to approach patients with compassion and love, number one, and then learning how to bring themselves to this service, the sacred service of being an artist really is in healthcare.
So how do artists get this training?
Well, in each of the hospitals that I've worked in, I have actually set up training protocol. So when we develop a program in the hospital, if there isn't an arts administrator, we assist in hiring one, and then artists go through a particular training that has been established. And actually, the organization which I talked about, the Alliance for Arts and Health, is putting together a certification for artists. So they're very soon in the next year will actually be like a national certification for artists, to be able to work in hospitals, which basically, is a composite of all the best information from programs that have been put together for the last 20 years.
And is this process a matter of hours, weeks, months? Like, what's the time?
Oh no, I think it's hours. It's a guideline. Two sessions. With a trainer. Mm-hmm. Okay. It's really when an artist does this, either an artist immediately resonates with this work or they don't.
Right. Yeah. And so are you? Well, I know that you began in the San Diego area, and we'll get to Vancouver, but I want to kind of save that till a little later. Where did it go from San Diego?
It's gone all around the country. We did a big project in Atlantic City, the hospital system there, that we went in. They had also, we were usually hired for new expansions or new buildings, for projects. And generally start off with visual art, and then are able to bring in the other participative arts programs from there. We've worked in Colorado, did a big program there. We spent 3 years doing a program in Minnesota. We're working, in several places in California. So this is my 36th year of working in the field, so the portfolio is very large.
Wow. That's great. And I would assume that this happened in a very organic way. People, somewhere saying, wow, that sounds wonderful. It'd be great if you could come and do that at our hospital. And, so it's kind of, you say that it's been across the country, but I imagine there are some areas that are much more active or much more has happened than other areas, and there's still a lot of places that could benefit from this information that don't yet know about what you're doing, etc.
I've had the opportunity of lecturing a lot on the field of arts and health. So I have lectured, probably all over the country, and been invited to six countries to give keynote addresses on the subject. And then the CEO of San Diego Children's Hospital and I wrote a book on the subject that came out in 2011 called Transforming the Healthcare Experience Through the Arts.
Right. I will make a point of, I'll just say this now at the end of this, when I put the links for this conversation that we're having on my YouTube channel and on my personal page, I will also put the title of the book as well as your website so that people will be able to reach you both ways.
So the Don Campbell work, we call it the ambient music programs, work in parallel. So it's not an either or. It's, our ambient music is up at 4 o'clock in the morning in the emergency room. It's up at 5 o'clock in the morning in the ICU. So it's there. It's there to help people breathe. It's almost like unconscious music to assist people in breathing through the stress and anxiety that they have through, this healing journey that they're going through. And unfortunately, Don passed away 2 years ago, maybe even be 3 years now. Our programs continue, and we're bringing on Gary Malkin as our musical director now.
Mm-hmm. Tell me about Gary. I'm sorry to say I don't know. I'm not familiar with Gary. Is he in San Diego?
No, he's in San Francisco. Gary is I think he won 6 Emmys for his music. But I think in the New Thought world, he's most well known for Graceful Passages. Do you know?
Okay.
Yeah, the piece that is. He has a whole Wisdom of the World music video series that you can, if you go to YouTube, you can find an enormous amount of material that Gary has composed. And so Gary works as an individual composer, pianist, as well as a choreographer. And what I love about Gary's work is that he's able to put together music that assists the relaxation response, but keeps you alert at the same time. So it's almost like it gives you an alert meditative state, which is different from a lot of the music that is out there that just puts you under a little bit or puts you to sleep, which is great when, for patients who have a lot of pain, but in waiting rooms and in public spaces, we want people to be able to make clear decisions, and to it's really music that connects the left and right hemispheres of the brain in a very intentional way that also entrains the breath.
Wow, amazing! I would love to hear that. I've never experienced that. How do you spell Gary's last name?
Malkin.
Okay. N as in Nathan?
It's Gary Malkin.
Yeah, the last letter is N as
yes,
in Nathan. Okay.
Yeah.
Okay. Great. I will include a link to him as well so that people can hear this after we're finished having our just some information from Karl. He's having computer programs. He's down. Please apologize to Annette. So he's with us in spirit, and I will also include a link to Karl, because I think Karl's doing wonderful work, and I'll now say in his stead that one of the highlights of this year's San Diego Conscious Music Fest was having Karl perform a few of his songs, and the one that I think really touched people a great deal was his song "Hold the Sky," which is also the title of his new CD, which he's now finishing up, in which he talked about going into, I guess, the San Diego Children's Hospital and befriending a child who was having chemo treatments. And he, in the conversation with that child, had said, "What does that feel like?" And he said, "It's like there's an earthquake going on inside of me every time I have the chemo." And I think Karl asked him something like, "So what do you do when that happens?" And his answer was, "Hold the sky." So that became the title of a song that they wrote together, and the title of the CD that Karl is finishing up. So much love to Karl for all the work that he does and continues to do with such love and consciousness. And I'm sad he can't be with us, but he's very much with us in spirit, for sure. So, so you continue to lecture and travel to other countries. What are the other 5 countries? Canada, the U.S. What are the other 4?
I keynoted in Japan, China, Sweden, England, and France. Yeah.
Wow. Fantastic. Now, did you have people translate?
Yes.
In French? Okay.
Yeah.
Wonderful. Wow. So, who has helped you in this work? I mean, I know that you've been guided by spirit, and a lot of people have manifested. I get all that, but who has supported you in this? Who has been around you when you've had tough moments, thinking, "Gee, I don't know if I can continue doing this, or where am I going to come from, or what have you?" Who's been your support system through all this?
Well, I'm very blessed to have an amazing husband who is an architect and has worked with me for the past 15 years in the company, and an incredible staff. I mean, I have 16 on staff, and many have been with me for over 20 years.
Wow.
And who really are invested in the work, and so just to give you a little framework, in the 80s, when I got started in the work of arts and healthcare, in the 80s, I realized that art was always an afterthought in the physical environment. First the architect would come in, the interior designer would come in, the building would just be about done, and they'd call in the plant lady and the art lady. And I became the art lady. And I didn't like that, because it we weren't allowed to affect the environment and be intentional. And from the very beginning, I felt like art needed to be integrated into the physical environment rather than applied to the physical environment. If art is the vehicle to communicate messages of the intention of the organization, then it needs to do that through the bones of the organization, in the bones of the building. So I grew the company and brought on interior architects, interior designers, graphic designers. And so the company, we're a healthcare design firm today. And we're very holistic in our thinking about physical environments as a component of the healing process, as the total sensual experience, including all the materials, all the smells, all the sounds, and so that's pretty exciting. So we have some wonderful clients that really have allowed us to do some fabulous work, and I feel very blessed with this opportunity.
And so, what's next? What's your vision for this year, the next 3 years, 5 years, whatever? Just what's coming?
Some of the work that I'm doing right now in connecting hospitals to the cultural institutions in the community. Healthcare is breaking outside of the barriers of, physical environments. We're looking at healthcare happening in, at least in America, in places like Walmart, right? And in small rural communities. So that, the connection between the art community and the healthcare community, how do you bring that together? And we've worked with several models, and model which has worked very successfully in Minnesota. We had, as I said, a several-year engagement there with children's hospitals and clinics of Minnesota, in which we facilitated partnerships between the Science Museum and the Guthrie, which is their theater group, and their music conservatory, as well as their children's theater and their children's museum and their museum of art. And so they all became partners in that they developed programs, or we worked together. They didn't work in isolation. So, bringing together clinical teams of people with arts educator people from the different museums to develop programs so that, there's live feeds from the museum, performances, so building theaters in the hospitals so that, there's continuous performances that are simulcast to patient rooms, bringing together artists that represent the different ethnic groups that the healthcare organizations, serve. So, that's a really important component, whether it's, Native, First People, Middle East, all of these cultures. We're such a diverse, we're such a diverse country, and same thing in Vancouver, so that how do we make these people feel comfortable while bringing in arts, especially music, dance, theater, that's representative of their culture, really makes a big difference. So I find this work really rewarding, breaking down these walls, and developing these relationships, and finding funding mechanisms to make these work. So that's my future work.
That's really exciting. I'm curious. can you talk about what you've noticed about the cultural differences between doing this work in Canada, say, or sorry, in the U.S. versus Canada or Sweden or France or whatever? Is there more of an openness to the ideas in those countries? Is it the same? Is it whatever?
Well, America is a melting pot.
Mm-hmm.
I think, Vancouver is a melting pot. Doing work in Sweden isn't necessarily as much. I mean, it's very new that there's the amount of immigrants that are going into Europe, right?
Yeah. Okay.
So that's very, very, I think it's very different.
Mm-hmm.
What we're trying to do is really address all these immigrant audiences,
Mm-hmm.
that, these institutions are serving.
Mm-hmm.
So the work that, we're doing in BC Children's, I think will be very diverse,
Mm-hmm.
because of the really rich, diverse community of British Columbia.
Mm-hmm.
So I think that's very, very exciting.
So let's talk about my backyard. How did you form connections with people in BC? How did that happen?
I had the opportunity 7 years ago to be on as part of a team that did calling a healing environment assessment of the hospital, and so is a BC architectural firm who hired us and knew of our work.
Wow.
And so we did an assessment of the arts, and the opportunities. So we looked at what kind of art did they have, and what were the opportunities, and they took it very seriously. And I think when they started building this new addition to the hospital, they gave us a call to see if we were interested in helping facilitate it.
Wow. And are you talking about the Jim Pattison Pavilion?
I don't know if it's the tech.
Okay.
It's not the Jim Pattison.
Okay. You know better than I. So, okay. That's a pavilion that I was in, so I was just wondering if it was that. Okay. So that's ongoing. It continues to happen, and you're coming back, as you were saying before we started this conversation.
Yeah.
You're coming back this week, and I get a chance to see you.
That's
yes. Wonderful. And so the latest, let's say, chapter of the Vancouver experience is what? What's going on specifically now? Like, what will you be doing when you're here this week?
I'll be, consulting and just assisting. We're in the beginning phase of the plan, mm-hmm. and so really working with the team there in, getting our arms around the plan of, what is the possibilities, right. And and then how do we bring forth these possibilities and, right. and get that adopted, by their committees.
Right. So how can the people who are listening to this help you in your work? Are there specific people that you're looking for? Are you looking for artists in various disciplines to connect you? Like, what is your outreach approach?
In about in a few months, we're going to be writing what we call a call for artists.
Okay.
So once we get all of our descriptions down in terms of what we're looking for, we will be writing a very detailed call for artists and publishing it. Mm-hmm. And we will distribute it among all the different arts agencies in British Columbia, because it's for the whole province.
Right.
And have a list of about a good 20 different arts agencies that will be published, and then we'll have a website set up with all of the information, about the call, and so that's pretty exciting. So yeah. Stay tuned. For that, there will always be a link on my website to it. So, and so people can search, our website. We do have links to different calls that we do in different regions. Right. So, if we're working in Seattle, or would definitely be a call for in that region. If we're working in North Carolina, it'd be a call for that area. Right. So that's pretty exciting to be able to enliven the arts, of the community.
Yeah. So let's take advantage of this moment to mention your website, which is aesthetics.net, which is aesthetics.net. There's an organization, just as in the last sentence, you just reminded me of an organization that I'm aware of, and I'm sure you are aware of them, that artists that go into hospitals and perform. And it's a U.S. organization, so the name escapes me at the moment. But I'm just wondering if you must be aware of them and have maybe reached out to them, or
there are many.
Okay.
There was actually BC did this amazing study, which was published in 2015 called MAP, and what they did is they mapped all of the arts organizations in BC that are working in hospitals, that are working in the communities. It was a magnificent report.
Wow.
And it's online. So if you look for the BC 2015 map.
Okay.
My hat's off to you because it was very well done, very comprehensive. It really gives a great snapshot of all. There's lots and lots of programs and lots of music programs, that are happening in long-term health.
And so it sounds to me, from what you're saying, that the depth and the scope of that is unique in terms of your experience. You haven't experienced anything like that in the U.S. or in the other countries that you've been to.
That they've actually mapped out a program like that. Yeah, I mean, I think that's it's pretty fabulous.
In the other four countries that you mentioned, Sweden, England, Denmark,
Japan, China.
Are there plans to do what you have done so far in the U.S. and Canada?
Well, what I've done there basically is I for instance, in Italy 2 years ago, I was a keynote in Florence at an arts and healthcare conference, and so they really like to understand, what is going on in the United States, and so many of my lectures in China and Japan have really been sort of an overview of the state of arts and health in the United States. Hold on a second. Please go to the other room. Telling my little granddaughter here to do her arts project in the next room.
She just loves her grandma.
One of the things I really want to talk about, the other thing which I think is an important trend, is the role of evaluation of arts as a healing component of healthcare. And, this really started a good 10 years ago, even longer than 10 years ago, probably a good 15 years ago. And it grew out of the work of architecture and interior design, where we're looking at, how the physical environment was being designed, but what does that do to improve health outcomes? What are the components, And so there was a lot of research, on light, single patient rooms, different materials, and so as the field of arts and health, which is actually very, very robust, 25 years later, 35 years later, it's very, very robust. There's actually, there's master's and a couple of PhD programs in arts and healing at this particular point. And so there's career opportunities, to teach, to be arts administrators, and to be researchers, in the field of arts and health, to be able to actually do combinations of qualitative and quantitative research to actually evaluate the role of the arts and healing. And And that's a really important component because, we now say that the field of arts and health has an evidence basis to it. Mm-hmm. And so a lot of what I do, in my consulting in healthcare is to educate people on, the basis of the research. Yeah. And so we can move from that particular point. And then I also encourage healthcare to actually do studies on each and every program. And it could be pretty simple. In Minnesota, when an artist comes and works with a patient in a patient room, it's very simple to do a survey, a 5-question survey. How are you feeling? How is your pain today? How is your day going? Yeah. And then we look at the artist's visit as a positive intervention, mm-hmm. and then we can measure afterwards. Did the pain go away? Do you feel better? Do you feel more positive? Mm-hmm. And it's amazing, to see the results of this. That patients derive not just huge satisfaction, but positive health outcomes, in terms of reduction of pain, it is amazing. And it's pretty statistically consistent, mm-hmm. All over the country.
Mm-hmm. And I would imagine it's the healing is, well, I'm assuming, you tell me, uniform, transcends any differences in age, race, gender. Healing is healing is healing. It has an impact on anyone.
Absolutely.
Regardless of all of those.
Mm-hmm. Absolutely.
Qualities.
Yeah. And going back to Karl, mm-hmm. so what Karl does, which is, I think the important part, he's not a performing artist. He's a participative artist. Mm-hmm. What he does is he gets these patients, these kids, in many cases, to sing with him. Mm-hmm. to express their voice, and that's, there's an amazing gift there. It's not, yes, there's a lot of value of being at a performance, but there's even greater value when there's this human connection and the patient can participate.
Yeah. Wonderful. Oh, I wish he was with us. Oh, well.
Sorry, Karl, we love you.
Is there any, do you have any video footage on your website about this? Just any feedback from patients or whatever, just any testimonial stuff about all the power of this?
Yeah, there's a lot of links, it's a pretty robust website. So yes, there are videos and links and a lot of information, about the effect of this work. Mm-hmm.
Are there any other cities in Canada that are aware of what you're doing? That Vancouver is the first, I'm assuming. Mm-hmm. And you'll want to branch out from there.
There's some great projects in Montreal. There's great projects in Toronto. I think I'm interested in working with clients that are receptive and open to the possibilities. Right. And I think we're at a tipping point at this particular point. I think the beginning part of my career was challenging in that people didn't understand. We didn't have the research, so I couldn't come and start a conversation with this works because, and be able to quote a whole bunch of different research. Yeah. So I didn't have that, and there wasn't a consciousness. So what's happened over the past 25 years is that the consciousness has grown. Where the whole idea of integrative health, complementary medicine, in many ways, the arts are another tool in complementary medicine, right?
Mm-hmm.
And so the understanding and awareness and consciousness of that has opened the opportunity for artists, to join the ranks as healers.
Mm-hmm. I feel like you've been answering this question in many ways throughout this conversation, but I'm just going to listen to my intuition and ask it anyway. Are there misconceptions that people have that you would really like to dispel, or just, what would you like people most to know?
Well, I guess which audience? So for healthcare institutions,
Mm-hmm.
I'd like them to know that they can afford to do this. A lot of people don't look at quality, intentional artwork because they think it's expensive and they can't afford it.
Right.
And my experience is that the community will support it.
Mm-hmm.
That it really does need to be supported through philanthropy.
Mm-hmm.
But there are enough people who the arts have made a difference in their lives,
Right.
That are willing to, financially support these programs, and that once you open yourself up to this, all kinds of possibilities happen. And that I personally have, and there are many, many great case studies of arts programs that are 100%, fully funded through philanthropy. And then to artists, I think that I want to. I want artists to realize that if this field resonates with them, that there's enormous opportunity, that this is a growing field, and this is an area that they can really thrive in. I think some of the most exciting moments for me has been to listen the stories of how these arts programs and creating art for healing has transformed artists' lives, has given them a deeper connection to who they are and what they can be. And then also the stories of the patients, and patients have a voice. That's another way to make this field grow, is through patients going to healthcare institutions and realizing that they're in an environment that may be a cacophony of sound. That it can be different. That healthcare doesn't have to be just noisy, and that the introduction of the arts, can really, really assist on that healing journey that we all go on. None of us are immune from that experience.
Yeah, beautiful. Pardon the sound of the passing train. Occupational hazard part of it. Fantastic. And I'm wondering, just wondering if the impact of this, I'm thinking primarily the difference between Canada and the US and the way that your healthcare system is set up and the way our healthcare system is set up. Do you find that has an impact on the level of philanthropy? Is there a difference in the level of philanthropy between Canada and the US, or is this a non-issue?
I think it's a non-issue. I think that Canada has, at least in healthcare, has embraced the need, for philanthropy. And then the institutions that I've worked in, the work has all been supported through philanthropy.
Wonderful. Well, gee, I had no idea about the scope of what you do in it, so I'm really happy and excited to become more aware of it myself and to be sharing your work and the impact and the power of what you do. I had no idea. This is really exciting to hear about all this, and I'm looking forward to going to your website and giving it a really thorough look. Sorry, go ahead.
So now you know why, being a co-producer of the San Diego Conscious Music Fest with Dave Avani was a natural for me.
Yeah.
It was. We put on a summer series of concerts.
That's right.
That it's just delightful. So it's a way of exposing this wonderful music to people that aren't ordinarily exposed to. So we will continue with that.
Yeah, and I was honored to be a part of it, and I look forward to being a part of it more. And you and I have talked a little bit outside of this conversation about perhaps me getting involved in whatever may unfold in BC, and I'm curious and excited about that, to explore that. And the other people that I consider part of my tribe in the positive music world, I will be making a point of speaking to all of them about this work, because we are spread out all over the place in both Canada and the U.S., and I would like them to be aware of what you do and see if there are ways that they can plug into their communities wherever they are and do this, so we can kind of help to spread the word and spread the healing.
Great.
I suppose that would be great. I'm wondering if anybody who is listening in on the conversation right now has a question for Annette. If you do, just come on in, and I will invite you. I will welcome you into one of the other two windows that we have. And while we're waiting for that, Annette, let me just see. Let me just review what I'm going to put as links. We're going to put a link to your site, aesthetics.net. We'll also put Karl Anthony's site, the title of your book, and BC 2015 map will be another one. Are there other ones that you would like people to be aware of?
Well, not offhand.
Okay.
Yeah, not offhand.
Okay. Can you give me the name of your book again, please? Or is it listed on your site?
It's listed on the site, yeah.
Okay. I'll find it there. Wonderful.
Yeah. Great.
Okay. I don't see anybody stepping forward to ask a... Oh. Karl did manage to type in a message saying, your conversation is wonderful, so sorry I couldn't get online. Karl, we too were sad that you couldn't join us in real time, and you are definitely a big part of this conversation, dear man, and we will, or I will be putting a link to your sites so that people can get a taste of you firsthand. And the world looks forward to hearing Touch the Sky when it's ready. Karl Anthony, ladies and gentlemen, Karl, that's Karl with a K, is a singer-songwriter based in San Diego, California. And he has a CD that he is just finishing up called Touch the Sky. I'm sure that you'll find out on his website, karlanthony.com, when it will be available. I think it will be soon. Well, gee, Annette, it doesn't look like anybody has any questions. Do you feel complete? Is there anything that you wanted to say that you haven't yet said?
I don't think so. It's been delightful having this chat with you, and I hope that those who have the opportunity of listening to this conversation have learned something about the field, and if it touches them, they to learn more about it. Yeah.
Wonderful, and I'm happy to help spread the word to a wider audience. And
there is an organization, BC Arts and Healthcare.
Okay.
I don't have their exact website, but that is definitely one people can look into.
Okay, I'll have a look for that too. So as I was saying, I will put links to all of these things within probably 10 or 15 minutes of this conversation being complete. I will get links, and then I will send them to you. And I will also put them on my YouTube channel as well as on my personal page, nathanaswell.com, so that people will be able to access this information at a future time and be healed and changed whenever in their own time frame. Thanks, Annette. I'm I'm grateful for the time we spent together today, and I look forward to seeing you in a couple of days in my hometown. Usually I'm traveling somewhere else, so thanks for returning the favor. And I'm sorry. Well, you're happy it's raining in San Diego today. I'm happy that it's sunny in Vancouver today. So there you go. A little, not the usual fare, but something that's pleasing us both. So that's good.
Great. Well, good evening then.
Love and blessings, everyone. Thank you for listening. My name is Nathan Aswell. This is Small Steps, Big Life. And my guest today has been Annette Ridenour, and who's just doing fantastic work. Her website is aesthetics.net, and I will be putting links to her site and to Karl Anthony's site and a few other interesting sites talking about the work that Annette is very busy doing, not only in the US, but now in Canada and in 4 other countries as well. And hey, tomorrow the world. Love and blessings, everyone. Thanks for watching and listening. Thanks, Annette.
Thank you.
Bye.
Bye-bye.